Hello, and thank you for joining us for our live Facebook Q&A about back to school and COVID-19. We'll be covering all your questions and concerns regarding going back to school, COVID-19, and fall physicals and vaccinations. I'm joined today by UI Stead Family Children's Hospital pediatrician Hao Tran, our expert who will be answering questions and helping you prepare your kids as they go back to school. So please submit any questions or concerns you have in the comments below, and we'll answer as many of them as we can throughout our broadcast. Just a note before we begin, this broadcast is for informational purposes only and is primarily intended for parents and guardians. If you or your child is feeling sick, please contact your primary care provider. Thanks for joining us today, Dr. Tran.
Great, thanks. It's great to be here. Thanks for inviting me.
Of course, we're glad to have your expertise here with us. So let's just dive right in. With COVID-19, specifically the Delta variant still present in Iowa, how important are back-to-school physicals this year?
Back-to-school physicals are more important than ever this year. Lots of families postponed or missed annual physicals last year because of COVID. So many children are behind on their vaccinations. So I really encourage every family to bring their children into their healthcare providers for annual physicals. It's important to know that at physicals, we assess a child's growth, we assess their development, we assess their social emotional health, which has been greatly challenged for children during the pandemic. We also address their chronic medical issues. So if your child has asthma or allergies or learning difficulties, we'd like them to come in so that we optimize their therapy or discuss and make referrals as needed. So please, it's safe to come in to the offices and very important. And most importantly, during physicals, we update needed vaccines, recommended and required vaccines. A very important time for vaccinations is during the 4 to 6-year-old age groups, also the 11 and 16-year-olds. So during the 11-year-old checkup, we will update the whooping cough, the tetanus. We'll also start their human papillomavirus series, which is a 2 or 3 vaccine series. This is a cancer prevention vaccine that we recommend for everybody. And we also start their meningitis vaccine. So it's more important than ever to come in for your school physicals. In addition, most people probably know who are tuned in that all children who are 12 and over are eligible for the Pfizer COVID-19 vaccine. And this is widely available in all of our UIHC clinics. And it's also widely available in Iowa at any pharmacy in the area, Walgreens, Walmart, Costco. So I recommend the safe and effective vaccine for anybody who's eligible in preparation for going back to school. I hope that answer wasn't too long, Elizabeth.
No, that was perfect. You actually touched on something that I've heard recently that a lot of people I know didn't know that they could actually go to their doctor or their child's doctor and discuss the vaccine. So is that something that if people are kind of on the fence and they're unsure, is that something we encourage people to come and talk to their doctor or their healthcare provider about?
Yeah, absolutely. We're very happy and want to be used as a resource for information for the vaccine. The University of Iowa website has a lot of very useful information as well, but please go to your providers who have firsthand experience at receiving the vaccine as well as giving it. And so please use us as a resource.
Great, thank you for that reminder. So what are some precautions you recommend to students who are going back to school to stay safe, not only from COVID-19, but common cold, the flu, and other sicknesses that they happen when we go back to school?
Yeah, so first of all, I really recommend that anybody who can get vaccinated for COVID-19 get vaccinated. So that is the most effective prevention or precaution against serious COVID-19 infection. So anyone who's 12 and older. Also, vaccinating other members of the household will protect anyone who's unvaccinated. So that's another measure that people can take. In addition to vaccination, mask wearing is definitely decreases transmission of COVID-19. So I recommend that vaccinated and especially unvaccinated individuals wear a mask in public indoor places. So that would mean in school classrooms and school buildings for children. In addition to mask wearing, it's very important that children wash their hands frequently, especially before eating and after eating. Not sharing food is also important so that to decrease transmission, as well as if they're ill, it's very important. So if they have any symptoms of fever, cough, sore throat, loss of taste or smell, to stay home and get tested. So those are the main ways that we can decrease transmission and stay healthy. Fortunately, we've learned that mask wearing not only protects against COVID-19, but also other cold viruses and even environmental allergies.
Yeah, and so you touched on colds and COVID, but something else we're seeing is an increase in RSV cases. Is that something you would touch on for our viewers?
Yeah, it's very interesting. Usually RSV season is in the winter, usually January to March. And because people were wearing masks so diligently during those months, as well as isolating more at home, we did not have an RSV season. Right now in August, I've never seen this in my 20 years of practice. We're having a surge of RSV. I believe because people have decreased wearing masks and are out more. Our hospital is full now with RSV and even the ICUs. So RSV is really surging as well right now. So, which is unusual, and that's the case all over the country.
And are the ways to stay safe from RSV, are those the same as anything else? Good hand washing, staying home when you're sick, wearing a mask if you have to go out in public and you're not feeling well?
Yeah, absolutely. Those same things. So social distancing, 3 feet or more, separation between people, wearing a mask, washing hands. Unfortunately, RSV mostly affects young children and babies more severely. And those are individuals that cannot wear masks themselves, but if the individuals around them mask, this will protect them.
Yeah, it kind of goes back to the reason why we encourage everyone who's eligible to get the vaccine, because there will be some people that still can't get the vaccine or just are more vulnerable. And so if the majority of us who can get it, we'll really be protecting everyone, right?
Yes, absolutely. So unfortunately, children under 12 right now can't receive it. So please, I urge the people who are over 12 to protect the ones who aren't vaccinated to get it. It will protect all those around you as well as you.
Great. And speaking of people who might have underlying health conditions or just are more vulnerable, should students with any kind of underlying health condition take different or additional precautions to stay safe this school year from COVID?
Not really. I believe that the same precautions that will protect everyone will protect children with underlying health conditions. Getting vaccinated, having household members vaccinate, wearing a mask in public indoor places, washing their hands frequently, these will protect children with underlying health conditions as well. But like I said at the beginning about physicals, though, if you have an underlying condition, please follow up with your provider regularly so we know, for example, if you have asthma, that your asthma is well controlled, that you're have a good supply of your medications. So that is the only thing different, I believe, as far as the precaution is seeing a provider specifically about your condition and making sure that it's under good control, or the best control we can do.
Sure. So one silver lining we've had throughout the majority of the pandemic is that the outdoors have kind of been a safe space for the most part. How safe are kids outdoors without masks this fall, do you think?
So transmission of COVID-19 is definitely lower in outdoor spaces. And this is because COVID-19 is spread through respiratory droplets. In the outdoors, air is always circulating. Unlike indoors, since the air is circulating, this brings the respiratory droplets down instead of spreading it from one person directly to another. So there is definitely less transmission and less risk out of doors. That said, the risk is not zero, however. If one child is 1 foot away from another who has COVID and both are unmasked, and one child coughs, there is a higher risk of transmission. Not as high as if they were indoors, but there is risk.
Yeah, so that kind of goes back to something that Dr. Wellington has shared with us a few times on our Facebook Lives, which is there's never safe, but there's safe enough. And so if you could define what you'd recommend to your pediatric patients, what is kind of safe enough in terms of just going out in the community? What would you recommend for kids that can wear a mask?
I strongly recommend that children over 2 wear a mask. I've actually had some children younger than 2 wear masks safely too when their parents teach them. So I recommend that they wear masks in public indoor spaces. I recommend that families start talking about this now as we prepare to go back to school. I think if parents start talking to their children, letting them know that wearing a mask will help keep them healthy and the people around them, including their parents and their grandparents, healthy. This will help the transition, let their students know what's expected of them is mask wearing, and to model this in public places. Children have been incredibly adaptable and resilient in this pandemic at mask wearing. I've been so impressed with every children and families who've been able to adapt very well.
Yeah, my 4-year-old, I mean, she's so good about it. If I don't have my mask in my hand when we're walking out the door, she stops me and is like, "Where's your mask?"
Yeah.
They're so good about it.
Me too. They're great at reminding the adults. So yeah, they're incredible.
Yeah, you're exactly right. So we know that hand washing is it's always important for preventing viruses and getting sick. But do we know if surface transmission is still a concern with COVID-19?
Yeah, fortunately, we know that surface transmission is low risk, that it's a very much less common mechanism of COVID-19 transmission. So washing hands frequently is important, but cleaning surfaces should be done just in normal protocol. So, daily as opposed to every hour as we initially thought. So I think shared equipment like in playground equipment, outdoor equipment should be fine. Shared gym equipment is not a high level of risk.
And would you just recommend, like, if I take my daughter to the park when we get home, we just hand wash then, or just in case to be safe?
So I would recommend that you wash before and after any activities, and then you're preventing transmission to others as well as yourself. So, the important thing is I don't want cleaning to detract from the more important precautions such as mask wearing and distancing. We don't want that to be the main focus or to take away the energy from other things that are more effective in decreasing transmission.
Absolutely. So vaccine, mask wearing, hand washing, they're all important, but those are what we like to see people do in that order. All
Absolutely.
right.
Yeah, thanks for summarizing it so well.
Oh, of course. Thank you for your expertise. This is helping me as a parent as well. We're here with pediatrician Dr. Hao Tran discussing going back to school and keeping your kids safe from COVID-19. So if you're just joining us, feel free to tune in now and go back later and watch what she's already covered for us. Comment with your questions or concerns below, and we'll try to answer as many of them as we can. So Dr. Tran, let's answer some of the questions that have been submitted through social media. So Michelle is wondering, if there are kids with RSV recommended to get tested for COVID-19, or similarly, if they're having symptoms of colds or RSV, should they also be tested for COVID-19?
Yeah, so the symptoms of COVID and RSV really overlap, so we cannot distinguish one from the other without testing. So usually we are, if a child comes in with symptoms caused by RSV, we are testing them for both to know. If a child has tested positive for RSV, we're usually not, I have not seen any children infected with both simultaneously.
Great. Caroline wants to know about how you can prevent transmission from person to person at home.
This is difficult, of course, right? Certainly if somebody is positive, then we recommend that they isolate if they're able, if it's a child old enough to care for themselves. So isolate in their room, eating on their own in their room, and wearing a mask. I guess similar to public indoor places, one way to prevent transmission in the home is for people to wear masks if they have symptoms.
Great.
And washing hands frequently and getting vaccinated.
All the things. Another person asked a very similar question, but how do you recommend preventing transmission from kids to kids? So, if there's kids that have it, is it the same thing that live together? Do you kind of quarantine one of the kids a little bit from the rest of the family?
Oh, I'm sorry. Are you saying how to keep immune compromised kids? I'm sorry, one more time.
So is it the same recommendation if the sick person is a child? So it's a brother. My brother's sick. Same recommendation for keeping me from catching it?
Yes. Yes, I recommend the same ways as masking and hand washing to prevent people in the household from catching it.
Great. The next question that we have from social media is about immunocompromised kiddos. Katie's wondering, how do you keep immunocompromised kids safe in potentially unmasked areas?
Yeah, so this is difficult, right? So definitely if the child is able to be vaccinated, if they're vaccinated, that is a high level protection for them. And I would recommend that they wear a multi-layered mask to protect them and to try to minimize your exposure to places where there's a lot of unmasking and they can't social distance.
Great. So someone asked on Facebook if we know when kids under 12 might be approved to get one of the COVID vaccines. Do we know anything yet?
Yeah, so this is a super important question that, so Pfizer BioNTech should be releasing their data from the study for 5 to 11-year-olds at the end of September. So they should be releasing their safety and efficacy data at the end of September. If it's positive, I'm sure that they will apply for emergency authorization use. And it's possible that we would have a vaccine available for those children. It's hopeful, very hopeful, by the end of this year or beginning of next year. Moderna, in addition, is supposed to release their data in the mid-fall, so soon after Pfizer. For 6 months to 4 years of age, Pfizer is also, both Moderna and Pfizer are doing a study on those children. That data will come soon after the 5 to 11-year-olds. So I think a vaccine for younger children is on the horizon. I wish it were before school started, but I'm glad that it's coming. we think that it's coming.
Well, that's exciting. Can you remind our audience what FDA emergency use authorization means and how it's different from a full approval? Just because it can be a little confusing.
Yeah, this is very confusing, and it's. I'd like to point out that it's very likely that the Pfizer and Moderna vaccines will receive full approval in the very near future. So possibly this month or next month, so that both of those vaccines will receive full approval. Emergency use approval is a mechanism for the FDA to approve medications, vaccines, equipment in a situation that's an emergency like the COVID-19 epidemic. The same criteria of safety and efficacy are used. These vaccines have been fully tested for safety and efficacy. In no way has that been compromised by the emergency use approval. The difference really is the timeline that the Pfizer and Moderna were able to apply for approval with a shorter length of time of data. Their studies are still ongoing and being collected, and they're applying for full use authorization, which I think is coming soon. So I would not let the emergency use approval scare you or make you think that these vaccines have not been studied as rigorously as other vaccines. They have, and they've actually been given to more people than many vaccines around the world that are approved.
Thanks for that explanation. So we know the vaccines are effective, but could you possibly break down for our audience what they're effective at? So how effective are they at preventing the disease, and then what else are they effective at?
So that's a great question. So one, the vaccines are very, very effective at preventing serious disease, meaning preventing disease where you need to be hospitalized or in the ICU or dying. They're upwards of 95% effective at preventing serious disease. They are, then the other endpoint is, are they effective at preventing infection? And they are very effective at preventing infection, but not as much as preventing serious disease.
So basically, if you do get the vaccine and you do end up catching the virus, chances are you're not going to end up in the hospital and you're not going to end up with a severe form of the disease, correct?
Absolutely, that's absolutely true. The people who are vaccinated, if they get infected, we call those breakthrough infections, have mild illness like a cold. If you go to the hospitals all around the country right now, the patients who are being hospitalized for COVID are the unvaccinated. Almost 100% of those in the ICU are unvaccinated. So the COVID-19 infection is very, very effective. All three vaccines are very, very effective at preventing serious disease and death.
That is so good to know.
They're amazing vaccines that we're so proud of the scientific community for developing. It's also important for people to know, and I know you guys have talked about this, that messenger RNA vaccines are not just new during COVID. They've been studied for a long time for other viruses and cancers. So we have had experience with these vaccines for other illnesses, not just COVID.
Yeah, and scientists have been studying the coronavirus family for decades, right? So we already have the knowledge to back the science.
Yes. Yeah.
Well, you brought up breakthrough infections, which is perfect because that's a question that we have here. How often are these breakthrough infections happening, and are they happening in fully vaccinated kids too?
I'm sorry, Elizabeth. We had some echo where I couldn't hear your question.
Sorry. How often are breakthrough infections happening? And then are they happening in kids as well as adults?
Yeah, so breakthrough infections are happening. They are the majority of breakthrough infections are in adults over 65. About 75% of the breakthrough infections are in adults over 75. I presume that as all infections and breakthrough infections are happening, that there are some happening in fully vaccinated children as well. But they are definitely mild illnesses, not causing hospitalizations or deaths.
Thanks for that explanation. So we know the Delta variant is the dominant strain in the US right now. How is it affecting unvaccinated and vaccinated people?
So the Delta variant, unfortunately, the bad news about the Delta variant is that it's 50 to 60% more transmissible, or almost twice as contagious as previous variants. So because of how quickly it's spreading, how easily it's spreading from one person to another, it's the dominant variant in our state and the states around us. So well over 95% of the COVID cases are from the Delta variant. It is definitely affecting unvaccinated individuals more than unvaccinated individuals. And as we just talked about, causing serious disease, mainly in the unvaccinated. So vaccinated individuals are getting breakthrough vaccines, and unfortunately, when they're infected, carry enough virus that they can spread the vaccine to another person. But are not getting so sick themselves. The reason the CDC recommended indoor masking for individuals who are vaccinated is to protect the unvaccinated again. Now with previous variants, we did not think, or we found that people could not spread the virus if they're vaccinated. With the Delta variant, they are able to spread it. And that's why it's important for people to mask to protect others around them, even if they're vaccinated.
Yeah, so if they're vaccinated and they catch COVID, they may not get very sick, but they still have that potential to spread it to others. And so that's truly why the masks are so important.
Yeah, and unfortunately, the most vulnerable unvaccinated are at highest risk.
Well, that leads nicely into another question from social media. Caroline wants to know how to keep high-risk kids safe who aren't old enough to wear a mask yet.
So the one important way to protect those kids is to vaccinate all the people that are close to them who are eligible for the vaccine. That is a very effective way to protect those children. And then social distancing, so keeping them 3 to 6 feet away from others. And then minimizing your risks by choosing where you go. Those are the different ways. Washing their hands frequently is important as well. And, people can also try things like shields, which may be more acceptable to children, face shields as opposed to the masks, which are not as effective as masks, but for those young children might be more acceptable or easy for them to wear. But so those different layers of protection of vaccinating, those people around them should also mask. That adds another layer of protection.
Great, thank you. Well, we are about at time, Dr. Tran. This half hour was so fast.
I think it's gone so fast. Yeah.
I wanted to give you an opportunity to just say anything more you would like our audience to know about going back to school and being safe this fall.
Yeah, so please come in for your annual physical so that we can address any chronic medical needs and see how your children are doing. I unfortunately Mental health has been severely challenged during the pandemic for children. We're lucky that children haven't been physically as threatened, but their mental health has really been threatened. And that's why we're so hopeful for in-person school. And we know that it adds some layer of risk, but I think we can minimize it with the things that we talked about today and serve our children by doing those things. They really need it. They really need to get back to school if possible, in person.
Great.
Thank you very much.
Yeah, thank you so much for sharing your expertise with us today. And thanks to everyone who tuned in. If you joined us after we started, make sure to go back to the beginning of the broadcast to hear all the great information Dr. Tran shared with us. And stay tuned to our social media and visit our website, uihc.org, for more information about COVID-19 as we have it. And remember to encourage hand washing with your kids, get the COVID-19 vaccine when you and your child are eligible. Make sure you get those physicals in before school starts, and stay up to date on accurate and reliable information about the COVID-19 virus as we continue through this pandemic. Thanks for watching.